They've got, you know, GLP-1 receptor agonists that are going to save everybody. You know, this is a promise we keep. You know, it's like, you guys remember watching Charlie Brown when you were a kid, and every, you know, fall, Lucy puts the football out there and she pulls it away from Charlie Brown. He flies and lands on his ass. I mean, it's just the same thing over again. We just fall for that stuff, you know, like a fish hook. We're all getting fish hooks again. And it's just, you know, well, this drug is going to be different. Yeah, sure. You know, I don't know. We just have people that keep falling for the same old thing, and nobody wants to change their, what they're doing. But the problem, I can tell you as a physician, the reason we don't do that is, one, education. Most of us don't know. I mean, we don't learn about this stuff. I mean, probably by design. I mean, the pharmaceutical companies literally pay for much of the curriculum that I learned in medical school. They pay for certainly at least half the the continuing medical education that I could be exposed to. And, you know, obviously they lobby and blah, blah, blah. And they're on, you know, they have a lot of influence on hospitals and how they're run, and all the major governing bodies, the ADA, the AHA, the American College of Physicians, and so on and so forth. So we have that going on. And, you know, it's one of those things where it's like, how can you change that as a physician if you don't even know about it? Well, if you know about it, you're like, well, I want to do the right thing. And I practiced for many, many years as a very busy orthopedic surgeon. I mean, seeing 50 patients a day, I got no time literally to have a discussion about lifestyle. I mean, how do you do that in a 5-minute visit? You can't, right? I barely got time to look at somebody's wound and then go to the computer and type it up, right? And so the problem is you do not have the resource as a physician to do anything about it. I mean, even if you're like, well, you need to do something. So what are we going to do? I'm going to send them to a registered dietitian who's going to tell them, you know, the same old stuff that doesn't really work. You know, just eat the cardboard, you know, eat the low fat cardboard. And a lot of people can't sustain that. So unless they have significant discipline, which most people don't have, they have a hard time with that. So they end up like, I can't eat it. I mean, I can't do it. So I'm just going to give up. And it doesn't. And then the physician says, well, it doesn't work anyway. So here's your prescription. I mean, this is what we've kind of become like eyeless fish, because we'd have never seen success. And so we just kind of assume it never works. And so unless you have a support system, unless you have the knowledge, the education, and a huge support system, like for me to do surgery, I got literally millions of dollars of support. I've got an OR that runs at $200 a minute. I've got a recovery room where you're paying, you know, circulating nurse and recovery room nurses, and, you know, the OR staff, you know, the respiratory therapist. I've literally got a guy that'll stand around in an operating room with a lead vest on for 3 or 4 hours while I'm operating. I mean, you think about all the support you're given. You're operating in $1 million, you know, multi-million-dollar facility. So if you want to do a lifestyle intervention, guess how much money is dedicated to that? What, $10, $50, you know? So it's nothing. So it's really hard to make a change in the healthcare system as it is. So we need a paradigm shift. And, you know, I'm trying to do that with our company, but, and there's other companies like that are starting to wake up to this stuff. But I mean, it's one of those things where I think we could, you know, I mean, you look at the healthcare expenditures. We spend by an order of magnitude more than many countries and our health outcomes are significantly worse for many countries.
Yeah. If you enjoyed this video, you can see the entire podcast at rumble.com/evening rants. That's rumble.com/evening rants. See you there. I'm looking for something to prime my body to reach my goals. You want to lose weight, but a lot of people just chase their tail trying to lose weight. Let me explain. You get the latest fad. You do the latest diet. You get on the latest pill. But think about it like a car. You can put the finest fuel in the car, but if the car is broken, what are you doing with yourself? You're just going to give your body this fuel, but the body itself is broken. Your body needs to operate efficiently. Your body needs your lungs, your kidney, your liver, your heart. They all need to be working optimally for your body to process the nutrients, to burn the fat, to even build the muscle. I'm looking for the best overall health and organ supplement ever created. And that's why at Ambrosia, we have something called Ambrosia Nectar. Since 2015, we've been focusing on things that other companies don't focus on. We needed people to operate efficiently with their brain. So we had mental jewels. We needed people to have proper fuel, Ambrosia Plant. But the product that I'm most proud of is Ambrosia Nectar. Ambrosia Nectar contains 13 natural, proven ingredients to help with all the things that make your body run. Ambrosia Nectar is what you need, and it is the perfect supplement to prime your body for whatever your goal might be.